So welcome to this SHRN webinar on improving school climate to support children and young people's mental health with me, Graham Moore. So just to introduce myself briefly before I turn my camera off to get my face out of the way of the slides. So I'm currently director of the Decipher Centre where the School Health Research Network is based. I don't have a direct role in SHRN anymore, but I was involved in establishing the secondary network from 2013 and I led on expansion to primary schools until 2024. And when I handed this over into Kelly's very capable hands, I continue to support Kelly and Honor within my Decipher role. I'm also lead on mental health in schools research within the Wolfson Centre for Young People's Mental Health. Aside from that, I'm a parent of two children, one of primary and one of secondary school age, and I'm married to a primary school teacher. So I kind of live and breathe schools in many respects, including in my work and beyond. So like I say, I'll turn my camera off now to get my face out of the way. So in terms of what I'm going to talk about today, I don't want to spend too long preaching to the converted, but I'll start briefly by introducing the role of schools in improving mental health. And there have been lots of kind of media stories and other communications in the past year or two around potential harms of school-based interventions, so I want to touch on some of those. I'll then spend most of the remaining time talking about school climate specifically, starting with what it is before moving on to insights from the growing evidence base around school climate interventions and mental health. And while, as we'll see, we know an increasing amount about how improving school climate can benefit young people's mental health, there are areas we still know less about, such as how improving school climate can impact on inequalities and how changes can be sustained in the longer term. So I'll conclude by touching on those points. And all of this is based heavily around a paper I was asked to write last year for the JCPP, and it's published in an open access form for anyone who really wants to get into the detail on this. So I'll start by talking about the role of schools in improving mental health. So in contexts like the UK, which have comprehensive education systems, intervening via schools enables us to reach the vast majority of young people, and of course there are caveats there. Many young people in Wales and across the UK are taught outside the mainstream school system, and that's grown since the pandemic. And often children taught outside of the mainstream school system will also be exposed to lots of other issues which do increase their risk of mental health difficulties. So we need to not lose sight of the fact that school-based interventions will often miss often very vulnerable groups of young people. But for most young people in Wales and across the UK, much of their waking time is spent in a school environment. And historically, lots of school-based interventions have just seen schools as a convenient means of reaching lots of young people at once. But schools are, in and of themselves, important environments which can have substantial impacts on young people's mental health. So in line with World Health Organization, Ottawa Charter principles, for example, we can see school-based interventions not just as being about delivering interventions to children within schools, but as having a goal of changing the system itself, to changing the environment of the school itself to optimize its potential health-enhancing effects. But while schools are an important avenue for mental health interventions, probably most school-based mental health interventions that have been well tested have found quite disappointing outcomes. And these are examples of large recent cluster randomized controlled trials which have looked at effects of interventions on mental health. So our colleague Judy Kidger, for example, led a trial focused on mental health first aid, which was conducted partly in Wales here, combined with staff peer support and awareness training, which had no effect on teacher or child mental health. A study in Australia, Andrews and colleagues looked at a CBT-informed e-health programme with some effects on mental health knowledge, but no effects on mental health symptoms. The large kind of Myriad trial looked at mindfulness training in schools, finding no effects overall, and actually some evidence of harms in some subgroup analyses. And given finite resources available to schools, there is potentially large opportunity cost in selecting and embedding interventions which may actually prove to be ineffective or even harmful. But beyond the risk of wasting resource on things that don't work, a lot of recent debate has centred around the risk of school mental health interventions achieving the exact opposite of what they set out to and making mental health problems worse. People often think about non-medical interventions as being relatively low risk. They might not work, but they'll probably be benign. So we don't need to worry as much about side effects or unintended consequences as we might for a new drug, for example. But actually, there is a long history of social interventions implemented with very good intentions doing harm, which I talk about in the review article, but I won't go into detail here. But in relation to mental health in schools specifically, one argument we increasingly see is that a focus on mental health awareness might drive up estimates of mental health related prevalence in two ways. Firstly, this might increase recognition. And that isn't creating new problems, but meaning we're more likely to find the ones that already exist, which is a good thing. But a more problematic second mechanism that's often discussed is overinterpretation. So some argue that mental health awareness interventions may lead some young people to interpret everyday emotions as a sign of a disorder, in turn leading to patterns of avoidant behaviour, which lead to everyday emotions becoming a disorder. Perhaps this prevalence inflation hypothesis, as it's often described, is most relevant for interventions which focus on things like mental health awareness and for therapeutically informed interventions, but discussion around it does sometimes drift into talking about all universal interventions as if they're the same in a very generalised way. Maybe it's less relevant for interventions which focus on improving school climate. I guess there is the question of whether if we remove all potential challenges from the environment to the point children don't learn to cope with anything they find challenging, does that lead to unintended consequences? So we do still need to pay attention to potential for harm. But I think we need to be careful first to establish whether that basic hypothesis that some universal interventions are harmful has merit. And even if it does, not to overgeneralize that to all universal interventions. So it's good we're talking about harms. I think people often assume social interventions are harmless, but we do need to ensure that we aren't overgeneralizing and throwing out effective approaches in doing that. So I'll talk now briefly about how we define school climate, what school climate is, and then I'll talk a bit about what we've learned from using the School Health Research Network data over the last 10 years or so to understand issues relating to school climate and mental health. So school climate is quite a difficult concept to define. So literature has a whole array of different definitions, some of which are so broad that almost any intervention within a school could be considered a school climate intervention. But generally, school climate is thought of as an aggregation of how a school is perceived and experienced by all the members of the school community, how people interact and the feelings of safety or otherwise which arise from that. So my working definition for the purpose of the review article that I linked to on the first slide was the overall feel and atmosphere of a school shaped by how staff and students interact and how safe people feel within the school environment. Just to give some examples from our research using SHRN data over the last 10 years in Wales, we found in one of our earliest papers on this topic that young people with the lowest well-being tend to be those from poorer families, but who go to schools with low levels of free school meal entitlement. So young people from poorer backgrounds report better teacher relationships in schools which serve more disadvantaged communities overall. That might in part reflect the psychosocial challenges of comparing yourself to others who are clearly kind of better off than you. But it's also likely that schools' norms, ethos and practices become structured around meeting the needs of the kind of dominant populations within their intakes. So perhaps schools are more sensitive to the needs of pupils from poorer families where they are kind of the majority of young people within a school, and less sensitive to their needs when they're in a minority. We've also found that young people transitioning to a secondary school from a relatively poor feeder primary school tend to experience reductions in their mental well-being, and children often transition from a primary school which serves a narrowly defined community to a more diverse secondary school, and perhaps for those children transitioning in from the poorest of the 6 or so schools, that change in relative status that they experience going to their secondary school kind of widens inequality and increases the kind of work needed to kind of hide relative disadvantage from peers. We also find that relationships within school can be particularly important for children who report less support at home. Some of our more recent qualitative work within the Wolfson Centre for Young People's Mental Health, using SHRN data and working with schools within the network, has kind of centred children's perspectives around school climate and the role of people and places within the school context in shaping their mental health and well-being. A lot of work using SHRN data within the Wolfson Centre for Young People's Mental Health has looked at time trends using data going back to 2013, when SHRN first started. We see big kind of real shifts in emotional difficulties from this time. So this is a paper that looked at how these changes are associated with changes in how under pressure young people feel from their schoolwork. And we find that both follow a very similar trajectory. So emotional difficulties have increased as perceptions of pressure from schoolwork have increased. We have to be very careful about causality. Perhaps as emotional difficulties rise, perceptions of pressure increase rather than the other way around. But it does signal a kind of trend toward school environments being perceived more stressfully over time by young people. And often school climate gets studied as if it's very uniform across schools, but there's often a lot of variation within schools that gets slightly ignored in these studies. And this is one of our most recent papers around school and classroom climate and mental health in primary schools. It has a bit of a personal backstory. My son has some additional needs which make the school environment quite challenging. One year he had a teacher who just constantly criticised him for things he couldn't help and just made him dread going to school. And you could see the toll on his mental health that year was huge. But the next year, on day one, his new teacher kind of sat with him and said, I know there are some things about school you can find difficult, but we'll work through it together. Really built a relationship with him. And immediately that anxiety lifted and he felt like he was in an environment where he was understood and supported. And he just wanted to go to school every day again. So even within what's overall a positive school climate, a single classroom can still be a very welcoming place or a very hostile place. And that experience gave me the idea for this paper, where we look at how mental health varies not only between schools, but between classrooms within primary schools. And we find here that there seems to be as much variation in mental health between classes within schools as there is between schools. So again, we need to be careful about not overly attributing causality here, but classroom climate seems to matter as much for young people's mental health as the climate of the school as a whole. And we might expect secondary schools to be somewhat different as children move between lots of different teachers and sometimes different clusters of young people. But this was a kind of first piece of fairly exploratory analysis we did with primary school data. So I'll just briefly talk through some examples of effective school climate interventions. And the recent review article that I linked to on the first slide provides a detailed overview of a range of interventions, from the Gatehouse project in Australia around the turn of the century to the more recent SEED trial in Scotland. And actually the Gatehouse project, the intervention didn't work in reducing depression, but that has been a very influential project in informing several newer interventions which have. And I think the steady stream of effective programs we're starting to see in the literature does owe a lot to kind of earlier efforts which didn't work but have now been refined and built upon. So I'll give a brief summary now of some of the more recent, more effective interventions. There's a lot more detail on this in the paper that I linked to. So a trial was conducted in southeast England of the Learning Together intervention a few years ago and published in the Lancet. And this was an intervention that included staff training in restorative approaches to kind of change disciplinary practices within schools, school-based action groups, including young people and staff, with some external supports to review kind of local data and identify changes to the school environment to create a positive school climate. And this was also supplemented with a social and emotional skills curriculum. And at 3 years after this programme was initiated, the team saw small but beneficial effects on a range of outcomes, including bullying, mental health, quality of life, substance use, contact with police. And a follow-up study also found evidence of improved GCSE performance in schools that implemented this intervention. Learning Together was in secondary schools. The SEED trial in primary schools in Scotland was conducted around the same time. It's only more recently been published. It had a longer term follow-up because it followed young people from primary into secondary school. And this intervention centred around kind of school-specific surveys with children on social and emotional well-being and school culture. Staff within the schools then worked with researchers and educational psychologists to identify and implement changes to the school environments. And the intervention also included a resource guide which listed interventions to match to issues that the school identified. And they found improvements in school climate at 4 to 6 year follow-up, and also effects on young people's mental health symptoms. The third example I'll discuss briefly, and this was published in the same issue as the Learning Together trial, and provides evidence that school climate interventions can work across very different contexts. So here was an intervention conducted in India, which centred around kind of promotion of social skills, engaging the school community in decision making, new policies around violence and bullying and substance use, access to knowledge around health, and enhancing problem solving. And they tested two versions of the intervention, one delivered totally by teachers and one with external support from lay counsellors. And they found beneficial effects across a broad range of outcomes. So school climate interventions often have a wide range of effects beyond just mental health. So they found effects on school climate, depression, bullying, violence, attitudes towards gender equity, and other outcomes. But one thing this study adds is that the intervention was only effective when it was delivered by lay counsellors. The teacher delivered version didn't work. And one reason for that might be that lay counsellor delivered version of the intervention brings additional resource into the setting to help drive forward delivery rather than just asking teachers to do more work on top of what they're already doing. So while increasingly we know quite a lot about the impact of school climate on mental health at the population level, we know less about how school climate interventions impact on inequalities, and also how those interventions might be sustained in the longer term. So I'll talk about the first of those two issues now briefly before moving on to the second. So this isn't something that's specific to school mental health interventions or even school-based interventions, but for lots of programs, evaluators tend to focus on, does it work? Does it do more good than harm on average? And it is relatively rare for interventions to be evaluated in terms of how they impact on inequalities. Do they work for underserved groups? And there are lots of statistical reasons why that's quite difficult to do, but it's important that we can consider how interventions can be designed and developed that in ways that consider equity from the outset. And how do we judge the success of interventions against whether they reduce inequalities or at the very least they improve population health without widening inequalities? And there are kind of relatively few school-based mental health intervention studies which do provide evidence about how effects vary by population subgroups. And where this is done, it does tend to signal a tendency for widening of inequalities, if anything. So the Myriad mindfulness trial I mentioned earlier had no effect overall, but some evidence of harmful effects for young people who are at highest risk at baseline. Learning Together intervention, the intervention worked for boys, but not for girls. There was no evidence of differences in effects by socioeconomic status, but worked better for boys than for girls. The SEED trial, we saw improvements in perceptions of school climate, but these were only once you broke it down by subgroup, evident for children from less deprived backgrounds. So risk there of kind of increasing inequalities in experiences at school. And I think we do need to avoid over-interpreting subgroup analyses from a couple of studies, and more data is needed to understand how consistent these patterns are across studies. But interventions centering on changing school climate do often draw on kind of data-led practices and involvement of young people in decision making. And there is a risk, depending on how that's done, that those processes end up amplifying the tendency for schools to better meet the needs of some groups than others. Who's involved in these processes and how? How do we ensure that voices of underserved groups are heard in those? So I've given some examples of interventions that have been well tested and we know are effective under trial conditions. But I'll talk very briefly now about kind of scaling and sustaining effective interventions in everyday practice. So what happens beyond the evaluation? And the scalability and sustainability of interventions is an increasing area of research, but what we know to date suggests that school-based interventions tend not to be sustained fully in the longer term. So, for example, the SHRN trial in India, after the trial was completed, some elements of the intervention were sustained in schools, but others weren't. Learning Together is another example where actually scale up proved quite difficult after the trial because it's a very complex intervention that requires a lot of resource to deliver. And there are kind of few examples of interventions which have been kind of developed, tested, and then implemented wholesale across whole education systems. But there is some kind of debate about the extent to which that matters and whether branded interventions can ever really be kind of replicated wholesale across education systems anyway, or does the evidence base that's emerging and coming together as a whole just provide insights into what works, which can be embedded into schools' everyday practice with kind of what support from wider systems, local authority, national government, and other kind of actors and groups who support schools. And if we look at some of the structures around school-based mental health and school-based health and wellbeing more broadly in Wales, an example. So from the literature we've talked about so far, a key component of lots of effective school climate interventions is provision of regular school-specific data to inform actions to improve school climate. And this happens in Wales via School Health Research Network surveys. So schools in Wales can monitor their school climate and other indicators of health and wellbeing via their SHRN data. Effective interventions often tend to depend on external support, external workforces to help schools to interpret data and identify actions to address challenges. So Learning Together, SEED, both involved external support. So here only worked when it was supported by external actors rather than just being done by teachers. And in Wales, there are workforces to support schools in interpreting their data and identifying changes that they need to make. There's also in Wales recent statutory guidance, not that recent anymore, actually 5 years old now, statutory guidance on embedding a whole school approach to mental and emotional wellbeing, which we're looking at within the Wolfson Centre. So the Welsh education system does include kind of elements of interventions or programmes that we know to be effective in improving school climate and mental health. The questions really for us to understand are do these evidence-informed elements and principles, do they cohere in a way that is likely to reproduce the benefits that we see in the literature of improvements in school climate? I'm going to conclude with a really brief summary of what some of the effective approaches to school climate appeared to have in common. This table is taken directly from the paper that's linked to on the first slide. We see that effective school climate interventions tend to involve external support from beyond the school system for change. So schools can't necessarily do it all on their own. They tend to include a focus on reviewing and revising existing policies and practices to make locally driven changes rather than just layering on new interventions. Lots of effective interventions focus on disciplinary policies, promoting alternative forms of discipline beyond punishment. Strong focus throughout these interventions on positive relationship building between students and between staff and students. School climate interventions often focus heavily on bullying and interpersonal violence as well. They tend to include mechanisms for young people to feedback on current strengths and weaknesses of their school climate and to input into decision making regarding priorities for change and how to bring those about. And in some cases, but not all, these interventions also include classroom curriculum-based components or skills workshops for young people. So I'm pretty much finished, but just to summarise, interventions in schools can take many forms. The evidence base provides us with lots of examples of what doesn't work, but there is a growing evidence base around school climate interventions, which suggests that these can have an impact on young people's mental health. Creating and sustaining a positive school climate appears to be important for children's mental health and a range of related outcomes, but Some key questions in moving this forward include how these interventions impact on inequalities and how they can be sustained in the real world. Beyond their effects can be sustained beyond an evaluation. Thank you for listening.